Karolinska University Hospital in Sweden. It's a fairly big hospital. We have 16,000 employees, 1,500 beds. To make a change there takes time. I think most of you understand that, and you have similar experience probably from where you are. You all responded very well, double-handed, ambidextrous. So at a university hospital, we need to have clear routines to treat our patients effectively and correctly. But we also need a space where we can fail fast and succeed faster. So that's what the solution was all about. And we worked with hepatitis C. 3 years ago we got a treatment for hepatitis C, so we can cure it in 12 or 24 weeks, which is amazing. But hepatitis C patients are a group of patients that are often forgotten about. They live often a very challenged life. They've gone through some terrible stuff, and they don't have a very well organized patient organization or a strong patient organization, different from breast cancer, prostate cancer. There were several reasons why we picked hepatitis C. That's one of them. We wanted to support them in a good way and make the care more effective for them. So for an innovation-focused organization, there are 5 major building stones. It has to be people-centric, and in our case, person-centered in terms of patients. It has to be open for innovation, and internally as well as externally. And we need the dynamic capability. And how can you be dynamic in a hospital with 16,000 people working every day and night? So that's why we created the Ambidextrous organization, to make things happen a little bit faster. Traditionally, when you talk about an ambidextrous organization, you look at 3 horizons. The most famous one is from down the street, as you say here, with Google, where you work 70, 20, 10% of the time. 70% in the core business. In our case, we work with efficient patient flow, high and continuously improving quality of care, and our focus is highly specialized care. That's what we are supposed to do. But then we have strategic projects which will take extra time from the members of the staff. This could be person-centered care, which are formalized ways of including the patient in the treatment. And it takes forever to get that into the system. Digitalization of different kinds. It could be video visits for patients instead of coming into the hospital. It can be home care instead of spending time at the hospital. We monitor them at home and we go and see them if it's needed. And then in other places you work with venture projects, which we don't. We're a publicly funded hospital, obviously. And then the trick is to combine all these 3 ways of working so that we meet in between the different flows. We have cooperations with companies, other institutions. We come up with new ideas, and we do research on these new ideas and ways of working, and all of this to benefit the patient at the end. So this is what we did for the hepatitis C flow. We created a parallel flow where we put 3 people, 2 nurses and a nurse assistant, and they do project-based work. Their role is to challenge the normal way of working. So they don't do anything like that the normal staff members do. They say, can we do this differently? The patients call in by phone, they never get to the right person. Why don't they text us, they said. So they text them. And you know, it sounds silly when I stand here talking about it, but in the situation we work in, it's the normal way of handling things. They follow up in a different way, and they continuously challenge what they see. One thing that they brought in was the video visits. So a lot of patients don't have to travel to come and see us. They've increased the knowledge among these affected by hepatitis C, and they made the treatments more personalized, more individualized, and the patients are more satisfied after when they come. We have improved our quality registry coverage of these patients. So we keep registries of all our patients, and we do a lot of research based on these registries. So now the registries for these patients are even better. We are doing a lot of video visits for these patients. They don't have to come into the hospital, as I said. They do a quality of life survey on tablets every time they come in. And the biggest collaboration we have created through this organization is that we work with the prisons in Stockholm. So a lot of prisoners do have hepatitis C, and they can meet with a specialist over video, which is groundbreaking, and hadn't happened if we didn't have the parallel track for these patients. So prisoners get quicker treatment from patients. They can be treated while they're in prison, and then they come out and they are free from the disease. So it's very successful in that sense. So we give them better access to healthcare. We know that we can make it better for the patients if we involve the patients in the healthcare, and if we collaborate with different stakeholders. Thank you for your time.
Thank you. Well done, Fredrik. What's the business model for this? So we're talking about changing the business model of healthcare, because you're talking about individualised clinical pathways, and I'm sure a lot of people think, well, that would be expensive, would love to do that. So, but you've made it work in this small trial. So what are your thoughts around how you make that a commercially viable, valuable proposition?
The commercial side of it would be that you see the effects if you make it possible to dedicate your work time to a specific flow. And let's say you spend 1 day or 2 days a week challenging the standard ways of working. You can see quicker results, and you say, we'll try this for a month. If it doesn't work, we'll change it. Otherwise, you say, we're going to start working differently, and it doesn't happen. So it's fairly clear in a big organization like that, where we don't purchase time traditionally, if we build this into the organization and make the staff members move in between the different tracks, so they pick up ideas, they bring it back into the normal setting.
Yeah, you make it sound so easy. Questions for other people? No? All right. Oh yes.
Was there? Did you begin specifically with this population and wanting to solve this particular problem, or were you like how are you approaching the creativity with this, with your kind of 20% time, because you're referencing the Silicon Valley model?
Right. We looked after we looked for a pathway where it would be suitable to try the model, and we looked for pros and cons why we would choose one over the other.
And how are you continuing to
have
this creativity moving forward?
Yeah, so now the big challenge is to move it into the standard of care, and we're also starting up in another pathway, so other patients will get the benefit of the model.
How do you gain buy-in from the leadership? You're going to change up something. I imagine you're changing up somebody's workflow for an entire month, and then what steps do you take to get the buy-in?
That is hard. It takes time, and it's a bit of sales work, internal, to explain the benefits and try to help them see the effect in advance. But it takes some discussion. Yeah.
Sorry,